Today we will learn about the bronchial asthma. Let's start with the introduction. In bronchial asthma, there is the impairment of airflow due to the contraction of the bronchial smooth muscle, which is called bronchospasm, and swelling, which is called mucosal edema. The factors which results in the bronchial asthma are allergy, infection, and psychological factors. Bronchial asthma results from the release of histamine, serotonin, prostaglandins, and leukotrienes. These all factors, histamine, serotonin, these all will precipitate the bronchial asthma. This will result into the condition called bronchial asthma. Now, today we will discuss in this video only the bronchodilators. Bronchodilators are sympathomimetics, methylxanthines. So let's discuss bronchodilators. It includes sympathomimetics. Sympathomimetics contain selective and non-selective beta-adrenergic agonist. Selective beta-2 adrenergic agonist will include salbutamol, terbutaline, bambuterol, and salmeterol, and non-selective will include adrenaline. Now, the mechanism of action of the bronchodilators are sympathomimetic drugs acts on the beta-2 adrenergic receptors, and this will result in increase in the cyclic AMP. The formation of the cyclic AMP will increase due to the increase in cyclic AMP. There will be bronchodilation and mucociliary clearance, and it also inhibits the release of the histamine, serotonin, and prostaglandins and leukotrienes. Now, salbutamol and terbutaline have rapid action, are better tolerated by inhalation, have rapid onset of action within 2 or 5 minutes of inhalation. Salbutamol and terbutaline are inhaled by MDI, meter dose inhaler with spacer, nebulizer, according to the condition. Now, the adverse effects of the bronchodilators are tremor, tachycardia, palpitation, and hypokalemia. Now, second drug groups which are used in the treatment of the bronchial asthma are methylxanthines. The mnemonic to remember methylxanthines is DEATH, DEATH, death. D for doxyphylline, E for etophylline, A for aminophylline, and TH, theophylline. Remember death for the methylxanthines, it is the mnemonic. Nowadays, due to the narrow margin of safety and availability of the better drugs, methylxanthines are rarely used and have many adverse effects, which we'll discuss in the following further video. Now, mechanism of action of the methylxanthines. Now, methylxanthines inhibit phosphodiesterase enzyme. This will result in increase in the formation of cyclic AMP. It will result in bronchodilation, mucociliary clearance, and inhibit histamine, prostaglandins, and leukotrienes. Now, theophylline. Let's discuss theophylline. Theophylline is poorly water soluble and it is not suitable for injection. Aminophylline is water soluble but highly irritant. Aminophylline is highly irritant. So the injection of aminophylline should be given slowly, not rapidly. Now, etophylline is water soluble and it is given by oral, intramuscular, or intravenous mode. Now, the adverse effect of the methylxanthines on CNS, it will cause headache, tremor, and convulsions. It will result in diuresis. On GI, it will cause nausea, vomiting, and aggravation of the peptic ulcer. On heart, it will cause tachycardia, palpitation, and hypotension. Now, other drug group of bronchodilators includes anticholinergics. Anticholinergics includes ipratropium bromide and tiotropium bromide. Mechanism of action of the anticholinergics. Now, it will block acetylcholine release in the bronchial smooth muscle. Now, it will result in the bronchodilation. It is preferred by inhalational mode. It is combined with beta-2 adrenergic agonist and results in prolonged bronchodilation. Now, this is all about the bronchodilators which are used in the bronchial asthma. Now, other drug groups we will discuss in the next video.